Welcome to the next module, which is on the digestive system. We're going to learn about the key functions of the system, the key anatomy and physiology and organs involved, and what the impact is for massage. And that means understanding different diseases and illnesses that your clients might present that involve this system, and whether or not it has any impact on what you need to do as a massage therapist. First of all, let's talk about the functions. So ingestion is first up on our list, which is really about taking in all of the things that we need in our body, whether that be nutrients, fats, proteins, all the vitamins, minerals and liquids, in particular water, that we need in the body. It enters through the mouth, and this process of ingesting food through that system so that it can be absorbed by the body is called ingestion. Next up, we have propulsion, and this is really the way it moves. So how do we get that movement of the food from the mouth through to the various organs in the digestive system? And this is what we call propulsion. The major organs of the digestive system consist of smooth muscle, a coating of smooth muscle inside them. And there's contractions and relaxations, which is called peristalsis, which creates this kind of series of alternating movements. So contract, relax, which pushes and moves the food forward through that system. And this is what we call propulsion. Next up, we have secretion. This is really important because there's two parts of digestion in terms of mechanical and chemical. And so for that chemical part of digestion, we need key enzymes that are going to break down food. And they are secreted in various organs of the digestive system and helps liquefy the food, adjusting the pH to make it more acidic and to start that chemical breakdown of the food in each part of its journey. Next up is digestion itself, and as we've alluded to, there's two parts of that. Mechanical digestion, which is the process of physically breaking the food down from larger pieces into smaller pieces. That begins with chewing in the mouth, but it also continues in the stomach with that muscular churning of the food, breaking it down alongside the chemical digestion. That also continues into the small intestine, where there's more churning that occurs with muscular constriction of the walls of the intestine, again creating that movement to break the food down even further. And that's called segmentation, which is very similar to the peristalsis that we have further up in the digestive system, except in the small intestine, that rhythmical timing of the muscle constrictions forces the food backwards and then forwards, rather than just driving it forwards through the system, which is what we have with peristalsis. The second form of digestion is chemical, and that breaks the small pieces of food down into simpler molecules. And this is carried out by those enzymes that are secreted in both the stomach and the small intestines, creating those simpler, smaller molecules that are then able to be absorbed by the body, which leads us nicely to the next function, which is, of course, absorption. And this is where the molecules, those nutrients, those liquids, move from the digestive system into the adjacent blood and lymphatic vessels to be used throughout the body. Finally, then, we have excretion, and this is the process of eliminating undigested material through the anus. This could be, food that can't be broken down any further, and the waste products that are left when all of the molecules, all of the nutrients have been broken down and absorbed by the body. So the digestive system is quite a large system, given it goes from, right through the trunk of the body. So obviously a lot of organs are involved in that. So what we're going to talk about here is really that passage of the food through the system and what each of these organs does at each stage in that process. So let's start out with the mouth, so where we take the food and the water in. And here we have the mouth, the tongue and the teeth. The teeth are an organ and a key organ because they start that process of mechanical digestion by chewing or mastication. The tongue is also involved. It's a muscle and we use it to position the food onto the teeth. So as we chew food, the tongue moves food that hasn't been chewed onto the teeth and helps us to make sure that we're chewing all of the food thoroughly. The tongue also initiates swallowing, and it also has taste buds which work with the nervous system, and that plays a key role in that sensory feeling of what we're eating, and also in speech. But when we're looking here at the digestive system, it's really that role in moving the food onto the teeth and in swallowing that's really key. Also in the mouth, we have a number of salivary glands, and they release saliva. Again, that saliva contains enzymes, and this is where we start the chemical breakdown. So it actually starts in the mouth. It's not just mechanical digestion that goes on at that point. Once we've chewed the food, a bolus is formed, and that moves towards the back of the mouth, towards the pharynx. And that pharynx is really important because it has a number of roles, because it's a common pathway, and it's involved in both the respiratory system as well as the digestive system. And there's a very important element there called the epiglottis. And when that closes, it allows the food to passage and progress to the esophagus rather than into the respiratory airways. So it's really, really important. And obviously it happens subconsciously that is closed as we swallow. The esophagus itself is a long tube, and it transports that food from the mouth, from the pharynx, and down into the stomach. It's located behind the trachea and moves downwards through the diaphragm. There's an opening in the diaphragm and down into the stomach. The walls of the esophagus are lined with smooth muscle, like we talked about earlier, which contracts and relaxes through peristalsis, propelling that food downwards to the stomach. The stomach itself is J-shaped, and it's a sac that stores that ingested food for further breakdown. Again, two forms of breakdown here. Chemical, so we get that pepsin, gastric lipase, along with hydrochloric acid. They secrete from the lining of the stomach and help break down the chemical bonds in that food to create a watery substance called chyme. All the while, that peristalsis continues, so we have that smooth muscle that lines the stomach, contracting and churning the food for mechanical digestion as well. So all busy in the stomach. Next up is the duodenum. The food is propelled from the stomach towards the small intestine, and the first C-shaped part of that intestine is called the duodenum. It's C-shaped, and it's nestled right up against the liver. Bile gets secreted from the liver and seeps into the duodenum after being stored in the gallbladder. From here, the food then is propelled to the next section of the small intestine, the jejunum, and then onto the ileum. And this is where 90% of absorption happens. Really, really key that once we've broken down this food, it's only useful to us when we can absorb those nutrients and those liquids for use around the body. The intestines float freely in the abdominal cavity, and the small intestine is about 7 meters long. They're lined with glands that secrete hormones and enzymes to further break down and digest the food as it transitions through the small intestine towards the large. Another organ we have is the pancreas, which is a really large gland, and it lies just behind the stomach to the left of the D curve of the duodenum. It's got two functions, both exocrine and endocrine. The exocrine function produces enzymes which help in digestion, and the secretions are drained from here to the duodenum. But on the hormonal side, or the endocrine side, a number of hormones are produced by the cells, the islets of Langerhans, which are really important in insulin and blood sugar regulation. The liver, the largest organ of the abdomen, is located in the right upper quadrant of the abdomen, directly below the diaphragm. It also helps to maintain the blood sugar levels and the fat levels in the body. But it also is used for storage, so it can store amino acids absorbed from the gut as part of that digestion for conversion into fats, carbs or proteins when needed. It also has a very important detoxifying function. So as we consume drugs and various toxins through ingestion, the liver helps to remove those by detoxifying. It also removes pathogens and circulating hormones in the body, so a really important cleanser of the system. It also helps in the formation of vitamin D, stores vitamins and minerals, and creates bile. That bile synthesis is really important for digestion and for the absorption of nutrients as part of the digestive function. The gallbladder is smaller, it's pear-shaped, and it lies in contact with the underside of the liver, and it stores and concentrates the bile that's produced before it is secreted and used for chemical digestion. So we come back to the passage of our food, and we've got the large intestine, which is much, much wider than the small intestine and shorter. So it's about 1.5 metres in length. It consists of 3 sections: the cecum, the colon, which has the ascending, transverse and descending elements, and the rectum. Its main functions are to absorb water, sodium and minerals from the chyme and make it more compact, ready for excretion. It absorbs vitamins manufactured by the bacteria in the intestine, and it stores the fecal matter until excretion takes place. Next up, we're going to talk about various pathologies of the digestive system. Some of these you may not come across, some you will, but really this is to give you an awareness of what the symptoms are of these diseases, what impact it has on the body, and then as a massage therapist, what do you need to know in order to be able to do your job? So first up is cirrhosis of the liver. Some of the symptoms here caused by the scarring of the liver can be jaundice, so a yellowing of the skin and the eyes, vomiting blood, dark and tarry looking stools, and also swelling in the legs and the abdomen. Usually this occurs due to long-term liver damage. And what we have is that scar tissue starts replacing the healthy tissue of the liver, and it stops functioning effectively. Unfortunately, damage caused by cirrhosis isn't reversible and can eventually become very extensive in the liver to stop functioning in its acute long-term stages. And this can lead to liver failure. Cirrhosis can obviously become fatal if the liver fails. However, it's a chronic and it's a slow-moving disease and can take a long time for the condition to reach that stage. And obviously there are various treatments available that help to slow its progression. So what does that mean for you? Obviously in those latter advanced stages where the liver's failing, massage is contraindicated unless medically advised. But in those earlier managed phases, then absolutely massage is something that can be given to a client. Next up we have GORD, which is gastroesophageal reflux disease. This one's much more common, and this is where we get a painful and inflamed esophagus. Sometimes it can be accompanied with bad breath, burping, bloating, feeling sick, swelling of the stomach, difficulty swallowing due to that acidity and that wearing away of the tissues in the esophagus. Here, again, it's not going to stop you giving massage, but we do recommend it's done on an empty stomach. Generally, this is a reflux, so this is where acid is coming back up into the esophagus. And if the stomach is trying to digest food on a full stomach, lying on their stomach, having massage can cause some of that acid reflux to take place. So it can be just quite uncomfortable for the client. Constipation, so technically this is, where we're not passing bowel movements regularly, or alternatively where there's incomplete emptying of the bowel. It can cause them to be hard, lumpy, unusually large or unusually small. And in terms of severity, this varies massively from people to people. Sometimes people have it for a short space of time and they don't experience much discomfort, whereas for others they can have chronic constipation where it's a long-term condition and does cause significant pain and discomfort. So again, no impact in terms of massage. We can absolutely massage clients who are constipated, but if we are doing abdominal massage, we want to ensure that the pressure is light, we're working with our clients, and actually that gentle massage along in the direction of flow of the food along that large intestine can help to relieve some of the symptoms or discomfort associated. Irritable bowel syndrome. This one quite hard as it goes through a lot of different symptoms, a lot of different recognition points, and sometimes conflicting ones. So sometimes it can be diarrhea, sometimes constipation, bloating of the stomach, wind, mucus in stools, abdominal pains, a lot of varying symptoms. It's something that you would be diagnosed by a doctor and your clients might let you know about. Um, Generally, it develops in someone's 20s. Twice as many women as men are affected, and its cause is not exactly known. It can be, the experts speculate it could be sensitivity of the gut to certain foods, it could be stress or lifestyle related. Really, the cause is not clear, but diet and lifestyle, exercise has been seen to help. It has no impact on massage, and absolutely keeping the client moving, getting the tissues flowing. If that helps to relieve any of the symptoms for your client, then it's absolutely something worth doing. Gallstones, these cause acute abdominal pain in the stomach or just under the ribs to the right. And the pain can sometimes radiate towards the shoulder. So that's good to know if clients do turn up describing these pains and that radiation towards the shoulder. It might be worth, suggesting that they go and see a doctor to have it checked as well. If the client is in acute pain, because gallstones can be very acute, the last thing they're probably going to want is a massage, and it would be contraindicated during that acute pain. Otherwise, if they're managed, if they're not causing acute pain, then absolutely we can massage people who have gallstones. Next up is hiatus hernia, and this one can cause the reflux that we talked about earlier, so GORD. What we'll find is this laxicity, allowing, that opening and closing and allowing that acid to move up. What we find is that sometimes lying on the back or on the stomach can make this worse. Okay? What can happen is that the stomach is protruding through the diaphragm and into the thorax, so getting this hiatus hernia. And what we don't want to do is add additional pressure onto the abdomen that might do that. So looking at positions like sideline, the client might find it more comfortable and get less reflux when in that position. In the case of an abdominal hernia, this is where part of the abdominal organs protrude through the muscles of the abdominal wall. A hernia can develop, and that would be anywhere between the chest or the hips. And it may have very few symptoms other than that swelling or protrusion in the abdomen or groin. It's a local contraindication, so you're absolutely not going to work around that hernia or in that location, and surgery is generally needed to fix it. Stomach ulcers, again, causing kind of acute pain to the stomach. It can cause indigestion, heartburn, loss of appetite, a feeling of being full sometimes it can be described as. Also feeling or physically being sick, and weight loss are some of the symptoms. Again, no contraindication for general massage, but if you are doing abdominal massage, it's about modification of pressure. So if there's tenderness and that increased acidity in the stomach, we don't want to inflame the client. So definite modification of pressure when doing abdominal massage for stomach ulcers. Next, we have a collection of itis here. So itis equals inflammation of various organs of the digestive system. So whether it's colitis, diverticulitis, enteritis, or gastritis, that itis is indicating to us inflammation of various parts, whether that's the colon, large intestine, small intestines, or stomach. The client would have acute abdominal pain and also changes in their bowel habits, bloating, wind, symptoms like that. Again, massage isn't going to make that worse, but if we are working in abdominal massage, we're going to modify that pressure and work in the levels that are comfortable for that client. Norovirus is an interesting one, given we've had a lot of it in the UK this year. And this is a vomiting bug, so it's sometimes called a winter vomiting bug, and it tends to last at least 48 hours. But, it's generally worse in the first 24, and this is where we'll get projectile vomiting, watery diarrhea, feeling very, very ill. It's contagious, And what's really important to note here is that we shouldn't be treating clients who've had the winter vomiting bug or norovirus for at least 48 hours after their last episode of vomiting or diarrhea, because it's still contagious during that window. You absolutely want to protect yourself and your other clients from catching something like this. So very important, if your clients have been sick, you ask them when was the last time they were sick, and making sure you've got that 48-hour window. Next up is Crohn's disease. Again, a lot of different symptoms here, and this is where we get chronic inflammation of any part of the wall of the bowel, and it's becoming more and more common. Like ulcers, maybe it's linked to the Western lifestyle, the stress, increased workload, lack of sleep, all of these things that we have today. But the cause, again, is not very clear. It's a long-term condition, and it causes inflammation of the lining of the digestive system. It has acute phases, more chronic phases where it's less active. And really, again, it's about working with your client. Massage is not contraindicated, but obviously if someone's in a lot of acute pain, it's probably not best to work on them until that pain level drops a little. Again, when working in the abdominal area, we're going to modify that pressure and make sure that the client is comfortable throughout. Hepatitis, again, A, B, C, D, or E, so plenty of different variations here, causes inflammation of the liver. It can be caused by viruses, and if so, it can be infectious in the acute stages. And hepatitis itself is just that term describing inflammation of the liver due to viral infection, or it can also be caused by damage to the liver, so for example by drinking excess alcohol. Some types of hepatitis will pass without any serious problems or issues, whereas others are chronic, can last a long time, and start causing scarring of the liver, so leading to cirrhosis of the liver, loss of liver function, and in some cases, liver failure. So it can become quite severe if it's chronic and long-lasting. As with most of these conditions, massage is contraindicated at the acute stage, especially if it's viral, to kind of stop the spread of it, and also because your client's going to be in such discomfort. But if we're in the chronic, duller pain stages of this condition, then absolutely we can work with those clients. So lots of information on the digestive system, and you might be asking, well, why do I need to know about this? What does this mean to me as a massage therapist? A couple of things to note. Massage of the abdomen can really relieve a lot of the stresses and pains from a lot of these conditions. But a couple of things to note. One is we follow the direction of the large intestine, so circling in a clockwise direction to help with the direction of flow of that material. And also we're looking at pressure and pressure modification, because research has shown that abdominal massage is effective for intervention in chronic constipation. It helps to stimulate that peristalsis, that contract and relax, that helps move food through the system, which will help increase the frequency of bowel movements and decrease discomfort and pain, which is obviously something we want to help with all our clients. So if you're interested, hit some references here on where you can read some more information on the anatomy and physiology of the digestive system, what the General Council to Massage Therapists has to say, the most up-to-date information on contraindications and the various pathologies. Hope you enjoyed this lesson, and we'll see you in the next one.